Assalamualaikum and hi everyone. I'm Noraza binti Pade and my partner Siti Fatimah binti Muhammad Ashim will be going to talk about how UiTM is using digital transformation to improve its system and focusing on the panel clinic system. We will see how the system makes healthcare management easier for both staff and students and how it helps the university run things more smoothly. Let's start with a little background. Panel clinic at UiTM were first set up back in 1974 under the General Order Chapter F Medical. These regulations were created to provide medical facility for staff and their dependents, including treatments at government hospital and clinic. They also cover reimbursement procedure for eligible family members. Before the digital system, managing medical treatment and claims at UiTM was handled through the previous process, which was completely manual. Staff had to fill out physical form, clinic verify them manually, and communication had to happen between three parties: the panel clinic, the university, and university management. As you can imagine, this process was slow, inefficient, and prone to mistakes. As UiTM grew with more staff and students across multiple campuses, the old paper-based system started to show many challenges. Managing medical treatments and claims became slow, difficult to track, and prone to errors, which created challenges for both staff and university management. Coordinating between panel clinics, university department, and management was another challenge that made the process even more complicated. These challenges highlighted the urgent need for a digital solution that could streamline processes, improve transparency, and make the system easier and more efficient for everyone involved.
So, what exactly is the UiTM panel clinic system? Simply put, it's a system set up by UiTM to manage healthcare service for staff and students. It coordinates medical treatment, monitor healthcare costs, and manage medical claims without appointed panel clinic. Basically, it makes sure that everyone can get proper healthcare efficiently while keeping the process organized, transparent, and in line with university and government guidelines. Now, let's talk about the main objective of establishing the UiTM panel clinic system. First, it's designed to provide organized and easy access to healthcare for both UiTM staff and students. Second, it helps the university control and monitor medical costs so resources are used efficiently. Third, it ensures that all treatment follow the guidelines from the Minister of Health and Minister of Higher Education. Fourth, it reduces misuse or abuse of a medical claim, making the system fair and accountable. Last but not least, it improves overall efficiency by using a digital system and centralized medical records, so everything is faster, more transparent, and easier to manage.
I will be sharing my evaluation of the UiTM panel clinic system. We will look at the external environment, the system workflow, and why UiTM decided to digitalize this process to improve efficiency and service for staff and students. For horizon scanning, I analyzed the external factors that encourage UiTM to move forward digital transformation. First, the Ministry of Health promotes the use of digital medical records and better monitoring of medical treatments, which pushes organizations to adopt more efficient healthcare system. At the same time, MOHE guidelines require public universities to practice transparent and accountable governance, especially in managing healthcare services and expenses. In addition, the increasing use of electronic medical records, e-claims, and systems like Hermes show that digital solutions are becoming the standard in healthcare management. With the growing numbers of staff and students across UiTM campus, managing healthcare manually has become more complex and challenging. On top of that, there is a strong need to control and monitor medical treatment expenses as rising healthcare costs place financial pressure on the university. Overall, these external factors clearly highlight the need for UiTM to adopt a digital and integrated panel clinic system to ensure efficiency, transparency, and better control in healthcare management. In this slide, I will share about workflow overview. By considering external pressure and the need for improvement, UiTM chose this workflow because it covers the entire healthcare process from eligibility verification to medical treatment, claim approval, and finally payment to the panel clinic. The process began with eligibility verification, where staff are checked based on the employment grade and student according to their study mode. Next, medical treatment records are issued and verified by medical officer. Then, medical claims are reviewed based on established rules to prevent errors or misuse. Finally, the financial system handles payment to the panel clinic. Overall, this workflow improves efficiency, ensure accuracy and transparency, and support staff and student satisfaction. Most importantly, it aligned with UiTM's digital transformation goals, helping the university move toward a more systematic, equitable, and technology-driven future.
Now, I will move on to the second part of the hinge approach, which is internal audit. In this stage, UiTM evaluate the internal environment of the panel clinic system. These include how the system operates, who is involved, and whether the current process is efficient or not. The main goal of this audit is to understand the strength and weakness of the existing manual system. Based on the internal audit, the UiTM panel clinic system involves several key work processes that are all connected and required cooperation from different departments. First, eligibility verification. Staff eligibility is determined by employment grade, and the student eligibility depends on their mode of study. This step ensures that only eligible staff and students can access medical treatment under UiTM panel clinic benefits. Next, medical treatment records are created by medical officer. Whenever treatment is given, these records are used for verification and monitoring. Because the system was originally manual, this will be physical document which sometimes causes issue. After treatment, medical claims are previewed and approved based on UiTM rules and entitlements. Once approved, the finance division process the payment to the panel clinic for service provided. Together, this step, eligibility verification, treatment record, claim approval, and financial processing, create a structured workflow that ensure accurate, transparent, and efficient healthcare management. Let's start with who involved in the UiTM panel clinic system. First, we have UiTM staff and students. They are the main users receiving medical treatment. Next are the panel clinics, which provide consultation, treatment, and other medical service based on approved eligibility. The Administration and Human Resource Division approve application, manage staff and student eligibility, and monitor clinic to ensure policy are followed. Finally, the Finance Division handle payment for all approved claims. Now, let's look at the challenge in the manual system. The approval process was slow because it relied on physical paperwork. There was a high risk of lost or misplaced documents, and some claims were duplicate or overlapped. Treatment record was sometimes incomplete, making it hard to monitor the workflow properly. The internal audit showed that while the system was in place, it relied heavily on manual process, which slowed down workflow and increased the chances of error. This clearly highlights the strong need for a digital panel clinic system to improve efficiency, accuracy, and overall management at UiTM.
For this slide, I will focus on N in new model creation, which explain how UiTM leverage digital transformation to develop a new and improved business model for managing its panel clinic system. Through this approach, UiTM moved away from manual process and adapt a more efficient, integrated, and digitally mature healthcare management system. Recently, UiTM introduced a new vision, mission, philosophy, and objective that strongly emphasize digital readiness. This shows UiTM's serious commitment to staying competitive in the digital era. At the same time, it reflects UiTM's effort to adapt to changing human values and meet global demands by producing competent Bumiputra professionals who are digitally skilled and future-ready. Previously, the panel clinic system relied heavily on manual processes such as paperwork and physical approval. This often caused delays, inefficiency, and difficulties in tracking medical records and medical claims. As a result, the system lacked transparency and was no longer suitable to support UiTM needs in today's fast-paced digital environment. To overcome this issue, UiTM introduced a new integrated digital business model for managing the panel clinic system. This model replaced manual workflow with a centralized digital system, enabling healthcare services to be managed more efficient, systematic, and transparent. It also helps improve UiTM overall digital maturity in healthcare management. In key future, one key improvement in the new model is the centralized registration system. Staff and students are now registered on a single platform, which helps reduce data duplication and improve the accuracy of information. Through the HR2U system, staff can easily access and manage their healthcare details in more organized way. Another important improvement is the real-time approval feature. This allows patients to receive medical treatment faster without long waiting times. At the same time, panel clinic can directly access patient information online, which improves coordination and significantly reduce reliance on manual paperwork. In addition, all medical records are stored digitally, making them easier to access, monitor, and track. Medical claims are submitted online after approval from the head of department, and the approval and payment process are handled systematically through the system, ensuring better control and transparency compared to the old workflow. The new digital model is clearly faster and more transparent. It reduces manual work and improves coordination among staff, students, panel clinic, and UiTM management, leading to a more efficient and effective healthcare management process. After implementing the new digital panel clinic system, UiTM has already seen many improvements. However, there are still some areas that can be enhanced to further strengthen the system and improve overall efficiency. One suggested improvement is deeper integration with UiTM financial system. This will enable automatic verification of medical claim and faster payment processing, which can further improve efficiency and reduce administrative workload. UiTM can also introduce a data analytic dashboard. Through this dashboard, management can monitor healthcare usage trends and medical costs in real time, helping them make more informed and strategic decisions. Another recommendation is developing a mobile application for the panel clinic system. This will improve accessibility for students and staff by providing appointment reminders, notification, and easier access to personal medical records anytime and anywhere.
Next is the gap analysis, which compare the current manual system with the future digital system. This analysis focuses on three main areas, which are data, people, and skill. So, how far UiTM has improved and what gap still exists? Okay, so looking at the UiTM panel clinic system, we can see some clear difference between the manual and digital process. First, for patient medical record, the manual system is kind of messy. Files get mixed up and it's not very organized. But with the digital system, everything is stored in one place, so it's much easier to find what we need. When it comes to time management, like registration, new panel clinic, patient, or processing medical claim, the manual way can take 1 or 2 days. That's quite slow. The digital system speed things up a lot. It takes less than a day, which is super efficient. The risk of error is also a big factor. With manual handling, mistakes are more common, like misfiling or calculation error. Digital system lower than risk because everything is automated. Transparency is another important point. Manual records are hard to track, so it's limited, but in the digital system, tracking is much easier, making the process more transparent for everyone. Lastly, financial monitoring with the manual system is difficult, is keeping track of costs and claim can get messy. The digital system makes this much easier because it's systematic and can generate report automatically. Overall, moving from the manual to digital really help make the system faster, more accurate and easier to manage. Focus on data, people and skill. For the data gap under the manual system, patient medical record were mixed with other files and not properly organized. This made it difficult to retrieve information and increase the risk of missing record. While the digital system on medical record are referred to the stored in one centralized system, this improves the accuracy, reduces duplication and makes monitoring much easier and more systematic. Next is the people gap. In the manual system, staff had a high workload because many tasks were done manually, which as document checking, approval and claim verification, process like penal clinic registration and medical claim could take 1 to 2 days. With the digital system, this process takes less than 1 day, which improves work efficiency and reduce staff workload. This allows staff to focus on more important tasks rather than repetitive paperwork. For the skill gap, the manual system did not require high digital skill. However, the digital system required users to have basic ICT and system navigation skill. Therefore, training and support are necessary to ensure that staff and penal clinic users can use the system effectively and confidently.
In this part, I will be sharing my evaluation of the UiTM penal clinic system. We will take a closer look at how the system works, how effective the workflow is, who benefit from it, and also point out some areas that could be improved. The goal is to really understand the system and discuss it based on clear evaluation criteria. Now, let's dive into how effective the UiTM penal clinic system really is. To start, one of its biggest advantages is speeding up treatment approval. This means our staff and students don't have to wait for hours or even days to get the medical attention they need. On top of that, the system helps reduce false or fraudulent medical claims, which protect both the university and the patient. It also brings more transparency and accountability into the process, making everything more organized and trackable. And of course, it's fully in line with UiTM Digital Transformation 2030 plan, which aims to modernize our operation across the board. Now, who actually benefit from this system? Let's break it down. Staff and students enjoy faster and smoother access to healthcare services. Penal clinic, meanwhile, have an easier time processing medical records and claim because everything is digital. University management also benefit. They can monitor healthcare costs, check clinic performance, and ensure compliance with policy more effectively. So, really, everyone involved sees a positive impact. Of course, it's not without challenges. The system relies heavily on technology, which means any downtime or technical glitch can slow things down. Some users may also struggle with digital literacy, and because we are dealing with sensitive medical data, maintaining strong cybersecurity is absolutely critical. So, while the system is highly effective, there is still room for improvement to make it even more reliable and user-friendly. In conclusion, the UiTM penal clinic system clearly brings many benefits. It improves workflow, increases efficiency, and ensures transparency in managing healthcare services. By addressing its weaknesses, like technology dependence, user training, and data security, the system could become even more reliable and user-friendly. Moreover, the system is not just a tool for managing healthcare. It reflects UiTM's commitment to innovation and modernization under the Digital Transformation 2030 plan. It demonstrates how digital solutions can make everyday processes smoother and more accountable, benefiting students, staff, clinic, and university management alike. As we move forward, continuous feedback from users and monitoring of system performance will be key to ensuring it adapts to changing needs. Overall, this digital transformation has set a strong foundation for better healthcare management, and we are confident it will continue to improve over time.